Hey, what's going on, everybody? I am Dr. Caban and welcome back to the channel. I am a board certified general surgeon and a fellowship trained bariatric surgeon in Ocala, Florida. And today I am going to talk to you about the gold standard of bariatric surgery, the Roux gastric bypass. I am going to discuss what is the Roux gastric bypass, how it will help you to lose weight, and how much weight you should expect to lose after the surgery. We will also discuss some of the benefits and disadvantages of the surgery. So let's get started with what is the gastric bypass. The gastric bypass has been done for over 4 decades and is considered the gold standard of weight loss surgery. The Roux gastric bypass has 2 components. The first component is a restrictive component. This is achieved by making a smaller stomach to limit the amount of food that you can eat. The second component is a malabsorption component. This limits the calories and nutrients that your body will absorb after you eat. That part is accomplished by bypassing 150 centimeters of your upper gastrointestinal tract. So not only you eat less because you're smaller, new stomach, but your body doesn't use all the calories that you ingest. As you can see in this picture, we create a small stomach about the size of an egg, and the small bowel is attached to that small new stomach, bypassing the old stomach and the first portion of the small bowel. This combination creates excellent weight loss. The surgery is done laparoscopically by most experienced bariatric surgeons. Unfortunately, I know of several surgeons that still to this day do the surgery using open techniques. If you see a surgeon and he tells you that the surgery will be done open, please do yourself a favor and find a second opinion. With laparoscopic surgery, you will have several small incisions instead of one large incision. Using this technique, you will experience less pain, shorter hospital stay, faster recovery, and fewer complications. The surgery takes between 2 to 3 hours, and you will spend only 2 nights in the hospital. By now, you're probably asking yourself about the weight loss of the surgery. Well, the average weight loss after the Roux gastric bypass is between 70 to 80% of the excess body weight. You can figure out your excess body weight very easily. First, find out what is your ideal body weight. A simple Google search will help you figure this step out. Your current weight minus your ideal body weight will give you your excess body weight. Then calculate 70% of the excess body weight, and that should give you the average weight loss in 1 year after the surgery. So let's go back to our favorite patient, Debbie. Debbie's ideal body weight is 150 pounds. Her current weight is 350 pounds. That means that her excess body weight is 200 pounds. 70% of those 200 pounds is 140 pounds. Debbie is expected to lose around 140 pounds in the first 12 to 18 months after the gastric bypass surgery. Now always remember that this is an average. Some people will do better, others will do worse. The more effort you put in the process, the better you will do at the end. The follow-up after surgery is the same as the sleeve gastrectomy. I will see you 2 weeks after surgery and then every 3 months for the first year. After that, I will see you once every year thereafter. I am going to do a video about the progression of the diet after weight loss surgery. So make sure you subscribe to the channel so you can be notified when I publish that video. Now let's point out some of the pros of the gastric bypass. Number 1 is the long track record. The Roux gastric bypass has been performed for many years, and we have a very good understanding of how these patients will do in the long term. Number 2 is resolution of medical conditions. Patients that undergo a gastric bypass and have a significant weight loss resolve or at least improve many medical conditions like diabetes, high blood pressure, sleep apnea, high cholesterol, and many others. The resolution rate for some of these conditions can be in the upwards of 80 to 90%. Number 3 is excellent weight loss. As I mentioned before, you can experience excellent weight loss in the short and long term with the gastric bypass. Using a combination of surgery, diet, and exercise, you can change your life for the better. Number 4 is short hospital stay and a low complication rate. When the surgery is done minimally invasive, your hospital stay is only 2 days, and the complication rate in my hands is around 5%. Unfortunately, things can happen after any surgery, and the gastric bypass is no exception. Complications that can happen after a gastric bypass include ulcers, anastomotic leaks, bleeding, strictures, and even death. I will be doing a video about the complications of bariatric surgery, and I will cover them more in detail in that video. For now, you need to know that the complication rate is low, but it's not zero. Complications can happen after bariatric surgery. I will also be doing a video about dumping syndrome. You could experience dumping syndrome after the Roux gastric bypass, and you need to educate yourself about it and need to know how to prevent it. Okay, so this is the end of this video, and I hope this information was beneficial to you. Don't forget to like the video, subscribe if you haven't, and I will see you on the next video.